I'm Malika. I'm the clinical manager for PDOMS in Danvers and a certified anesthesia assistant. And I'm just going over the protocols and the setups for an uncovering tray. And uncovering is basically when a person comes in and they get an implant and we cover it over with a flap of tissue and we suture it up. When they come back, we make an incision, we open up that tissue, unscrew the closure cap or cover screw, and then go ahead and put on an abutment. And in order to do that procedure, we first need a surgical kit. So this is a basic surgical kit with everything in there from extraction instruments to a rongeur, a needle, a blade holder, suction, and everything that you need to go ahead and do an uncovering, with the exception of a few different instruments that you probably don't need, but you have pretty much everything you need. So you'll use that. You'll have your topical, a patient drape, a sterile drape. I just put this here for the time being so we can take a look at what we need here. Okay. Typically, if it's 1 tooth, you really don't need more than 1 carpule of lidocaine, but I put 2 on the tray. And usually it's not a block, it's an infiltration, which they'll just get the area numb and cut a small piece of the tissue off. So I put a blue needle on the tray, a blade, a suture, possibly. They may not even need that depending on the size of the flap that they use. If it's a 3I, which is the type of implant, they will use a tool. And typically they'll use a tissue punch or a rotary punch to either open up the flap if they don't need, a blade to do so. Okay? Now, there's 2 different types of implants, as I said, 3I and Strawman. So if it's a Strawman, what you're going to do is you're going to print out, for every uncovering, you're going to print out the implant tracking sheet, which looks like this. This is going to tell you the date of the surgery, the tooth that we did, the patient's name, and it's going to tell you what type of implant we used. In this case, this was a Strawman implant, and it says that we used in a regular body, which is RB, closure cap. Okay, that'll give you some information. So now you know that you can go ahead and have the Strawman abutments ready. If that was 3I or Biomet, you would go ahead and have the 3I or Biomet abutments ready. So this is what the 3I or Biomet abutments look like, and that will be in its own cart. And this is what the Strawman abutments look like. Okay? The dentist will usually specify which ones he wants you to grab. So I would just bring the entire box into where you need it to be. Also irrigation if he needs to use that. So we also want to make sure that we have a torque kit in here, because a lot of the time what we'll do is when we do an uncovering is we'll surgically release the patient, which means that we torque the implant to make sure there's no rocking or movement. And if it's a Strawman implant, you'll take what we call a star driver. It looks kind of like a star, and the latch head for the torque, and put it in, kind of twist it until you hear it connect, and then make sure it doesn't pop out. And usually they'll start with a 10 Newton centimeter torque, and you'll have that set up and ready to go for him. And then he'll do the rest. He'll take that off and put on the 20 Newton centimeter torque and do the same thing. If it's a 3I, you'll go ahead and repeat the same exact process using a Hex Driver. Okay, it has 6 sides, hexagon. You'll go ahead and put that in there for him. Okay, now the other thing I wanted to say about the tools, which is the thing I showed you in the beginning, once they uncover the flap, sometimes the cover screw or closure cap is covered by bone growth. Okay, in which case sometimes you'll need a handpiece to take off some of that bone, so you might want to have that in the room set up as well, just for the sake of efficiency. And the other thing is a tool. What this tool does is it goes right around the implant and it kind of removes some of that bone around that implant so that you can fit an abutment right on the top there and it's not interfering. But this kind of tool is only for a 3I or Biomet implant. If you have a Strawman, you will have the Strawman kit on the tray, and it will have those profiler tools inside of the entire kit. So make sure you have that handy as well. And that is what you need for an uncovering.